Let's talk about a brow lift. What is a brow lift?
A brow lift. Okay, so a brow lift or a forehead lift is treating the areas that frequently include the eyelids. So this area here has to be looked at as a unit. Okay, so in the past there were different types of brow lifts. A traditional brow lift, which is rarely done now, involved an incision all the way across the top of the head, and then the skin would be released and the skin would be brought up to elevate the brow. The things we're trying to accomplish with a brow lift, there are again three things. As we age, the corner of the brow tends to fall down. It makes us look sad, and it also increases the amount of skin that you have hanging down on your upper eyelid, and that's called hooding. Okay, so some people come into the office and they think they need an eyelid lift, when in fact it's the brow position that's too low. So in the brow lift, we want to raise the corner of the brow. We don't want to raise the center brow because that's not a normal position. The brow is usually higher on the outside than the inside. If you raise the central brow, it looks abnormal. One major thing that has changed with brow lifts is the amount of Botox that's used. Okay, so again, there were three areas of concern for the brow. One is the outer brow, which needs to be raised. The second area are lines that go across our forehead. And the third are the creases in the central brow that make us look angry, the frown lines. So many people have Botox injected in that area now, because that's the #1 area that Botox was first FDA approved for, that patients come in and they don't have frown lines. So the main area that they need treated is the outer brow, which is still hanging in a lower position. So many patients now have a modification called a temple lift. This area is the temple. And if this area in the center is already smooth because they've had Botox, then the only area that we need to treat is the outer brow. So that only involves one small incision in the hairline, and then we come under the skin, raise that corner of the brow, and that's all they need. So that's probably the most common brow operation that we do now.
So patients who are using Botox as preventative and maintenance can now just get by with just a lower brow lift to get the maximum results from compared to years ago maybe when they would need the whole full brow.
Right.